In this video today, we're going to talk about facet joint disease, how it impacts you, how it causes back and neck pain, and is one of the leading causes of pain in general. If we haven't met, I'm Dr. Orlando Landrum, an interventional pain and regenerative medicine specialist who helps patients understand why they have pain, what they can do about it, and how to be able to punch pain in the face and get back to leading the life that they deserve. Today, we're going to talk about facet joint disease and give some understanding about how it is one of the leading causes of back pain. As an aside, back pain affects probably greater than 30 to 40% of most people during the context of their lives. The most frequent cause of back pain is a muscle sprain, but thereafter, having issues with the facet joint is one of the most prevalent conditions. So when talking about facet joint pain, we need to start from a beginning. And one of the beginnings is the anatomy that's associated with it. There's two parts to the joint, like many joints. There's a superior articulating process and there's an inferior articulating process. And these two joints come together to form a synovial joint. So what is a synovial joint? A synovial joint is a joint that has a coating and lining that has fluid that basically is a capsule that lets that joint function in a smooth moving motion. So if we were to take a look at that with the model, we would see a model that looks kind of like this. And as you can see, there are little joints that allow for there to be articulation. And those articulations sit in the areas in and around here. And so when you take a look and you look at this in the lumbar spine, you can see the same type of thing that takes place here. So that when you have a twist, when you have a bend, these joints are associated with that movement. As we would expect, those joint movements over time can have some degree of degradation and degeneration. And with that, you can have associated pain. So today, we're going to give an understanding of not only that facet, spelled F-A-C-E-T, similar to the same way as you'd have a face of a gemstone, but we're also going to talk about what are most of the common experiences of patients. So traditionally, those individuals that have facet joint pain, they have pain that gives them an issue when they first get up in the morning and gets better throughout the day. It's worse with bending, twisting, turning, and it's traditionally worse with storms and cold weather. Many times, NSAIDs like Aleve, aspirin, and ibuprofen are used to try to be able to help mitigate some of the pain that is felt, as well as different topical treatments like heating packs and ice packs to try to see if it can be able to decrease the underlying problem. One of the classic ways to be able to assess facet joint pain is to see, does the person have pain when they go from a seated to a standing position? And in doing so, that initial movement, does it cause pain? And if so, you very well may be a candidate for having facet joint pain. We actually have a number of talks and videos that discuss what to do about it, but getting clarity about what causes it, what's the anatomy, and how to be able to help your clinician or others make decisions about next steps is huge. So when we look at facet joint, one of those things about that joint is that it also has nerves that supply sensation to the joint. And they supply sensation to the joint. And in doing so, they actually let you know if there is a reason for having some degree of pain. And those nerves that are sensory in nature can be treated in different ways, traditionally with the radiofrequency type treatment option. In addition to using radiofrequency, another alternative is using regenerative medicine to try to be able to heal the synovium and the capsule that's present back to a natural or native state if possible. One of the most challenging aspects of the facet is that it exists in continuity with the rest of the spine. So it's not just a joint and the rest of the spine is separate from it, but more so when you have that joint that has an issue, it can cause a problem with the disc. It can cause a problem with the orientation of the vertebral body at that level. It can have a resulting downstream effect of having issues with stenosis and something that's called spondylolisthesis, all of which have their own characteristics of having potential pain. Can you be able to identify this on imaging reports? You can. You can see it in the X-ray, CT, MRI, and occasionally, depending on the degree of resolution, sometimes even under ultrasound. Facet joint pain is frequently underdiagnosed, but it is one of the leading causes of pain. And there are constant therapeutic options that are coming out to be able to do treatments that don't rely upon traditional open surgery in order to be able to deal with it. Facet joints aren't only located in the lumbar spine, but they're located throughout the spine, including the thoracic, meaning the mid back, as well as the cervical spine, and including the neck. One of the ways that facet disease presents itself in the cervical spine is the inability to be able to turn and look over your shoulder because it results in pain. Normally, because there's been a whiplash injury or trauma that has resulted that has injured those joints that are present in the neck. So, one of the ways to be able to assess, do patients have a problem with their neck that's a cervical facet joint issue, is can they turn and look over their shoulder when they change lanes or when they're taking and driving their vehicle in reverse? If it requires them to isolate their body and turn their entire body, as opposed to turning their neck, then they very well may have cervical facet pain. Question of the day. Do you have pain when you first get up in the morning or when you get out of a chair or when you attempt to turn within the areas of either your neck or back? And if so, how have you been able to treat it in order to try to get some relief? If you found this video helpful, please hit the like button if you thought it was worth it. If we gave you information that you thought was useful and you'd like to know more information and on other topics, please hit the subscribe button. Thank you so much and have a great day.